Welcome back. It is exactly 11:40. I have a guest who goes back many, many years with me in my early days of radio. I always depended on Dr. Ken Resnick regarding education and parenting, and it's wonderful to be talking with him once again. Ken, we are going to talk about your Smart Choice parenting program, but I also see we're meant to be covering AI tools in education in this day and age. But because of time constraints, I'm going to put off that part of the program. I'm going to postpone it for next week, if you will indulge us, please.
Sure.
And let's just focus on, I guess, the vision behind Smart Choice parenting programs. So, very good morning to you. Welcome to the program and wonderful talking with you again.
Good morning, Judy. It's an absolute pleasure, and it's really nice to see you've got younger by the year.
Flattery will get you everywhere. Okay, so Ken, thank you indeed for the compliment. Um, for the people who don't know you, I know you very well, obviously. Tell
Yeah.
us your background and what led you to develop the Smart Choice Parenting Program.
But that's quite a history. I'm not going to bore you with that. But when I became a psychologist, it absolutely amazed me that in the training of virtually all professionals working with kids, there's nothing on parenting. So the kids are being assessed. The parents are the key role player. If you think that we guide them into adulthood, re-equipping them with the skills to take on life. They're totally dependent on us because they're born with a brain and nothing else. They're not born with self-esteem. They don't have cultural or religious values yet. They don't have social skills. They don't have grit. All of these things, we have to know how to instill that in our child. And this has been ignored. And as a result, what we are doing at the moment, what we've been doing for years and years, assessing, sending the kid for therapy, often putting them on medication, but there are a number of very worrying trends. And for me, one of the key factors is that virtually all kids today are impulsive. Now, I ask professionals, I ask parents when I talk to them, why is that? Why is it that so many kids are impulsive? Nobody gives me the right answer. It's a simple answer. When a little 5 or 10-month-old baby crawls, or 1-year-old crawls up to their parents got something in their hand, they just grab it. They don't ask, they grab it. So they're born impulsive. Every human child is born impulsive. They're self-centered. They're only about themselves. So what is lacking? What's lacking is manners. Manners seem to have gone out the window. And manners slow a kid down. For instance, that little 1-year-old comes and wants to grab something, you just got to say to them, no, ta. Say ta. They don't want to say ta. They don't get it. They can have a little cry, but they don't get it. Eventually they'll say ta. They take it. What do they have to say after they've taken it? Say ta again. Now that slows kids down. And today, kids just help themselves. There are no sort of boundaries. They believe the house belongs to them. They go to the fridge when they want, leave their toys lying around, leave the remote control, you name it. Lots of screaming and shouting, unfortunately. But so what is happening because of that? We are bringing up these impulsive kids that want things on demand. And you'll find that virtually with all these disorders, from the ADHD to oppositional defiant to anxiety disorders, those kids are impulsive. Now, a simple little thing like that, parents can do from birth, where they set down the boundaries. The kids have to ask, they've got to know they can't take things that don't belong to them. And they've got to say thank you afterwards. Thanks for supper, Mom. Excuse my fingers. Thanks for waking me up. Thanks for taking me to school. Mom's on the phone. Sorry to interrupt you, Mom. And they've got to know how to stop that impulsivity. Now, for me,
So,
this is a
Ken,
yes,
let me come in here.
sure.
Um, what you're saying is very, very worrying. But it's also what I've observed over the years. And when you are in a social setting, you see it playing out over and over and over again. And I think people like yourself and people in my generation as well are probably already suffering the brunt of the fact that what you're talking about is that we give away of our power as parents and adults way too early in life. So the kid is 3, 4, 5 years old, and already we're giving over our power to that child. So, in fact, what you're saying is that the children are controlling us. We are no longer in control.
100%. Absolutely. Because, of course, remember, they're born thinking they're in control. And they're only worried about themselves. And you must remember, children are actually tough as long as you don't abuse them. If you have a little argument with them, mom can't sleep, the kid goes to sleep, they're fine the next day, as long as they got their own way. So they don't have a thing like a conscience when they're very young. They don't really have empathy. And unless we train them how to start considering others, how to take responsibility, how to make choices and take consequences through bad choices, you can actually help them become aware that they own the problem. And today, unfortunately, parents owning the problem, where there's lots of screaming and shouting, and the kids chilled. And unfortunately, the only thing that seems to keep kids quiet is putting them in front of the TV or letting them play these games. But I mean now, wow, that is not okay, because there are just so many, if you've got the time, there's so much I can talk about since I last saw you. So can I
Absolutely.
just mention one of the consequences of what's happened, certainly since COVID? Can I talk about that?
Of course, please go ahead.
Okay, so because there's so many things that have happened. So this is one of them. So what has happened, especially since COVID, is that a lot of kids didn't learn online properly. When they went back to school, a lot of them didn't want to go back to school. They'd much rather have stayed at home. But what is the message we gave them? Because they'd missed so much school. All right, sweetheart, you go back to school. If you can't understand the work, somebody will help you when they get home. Well, what are you saying to a kid? You don't have to listen in class, because you don't have to worry. Somebody's going to do your work for you when you get home. So we're actually encouraging what they call a helplessness, where the child gives up without trying. They'll come home, Mom, help me with my maths. I haven't even opened the book. And they can't read. I mean, there's so many kids that are not reading and comprehending. I cannot tell you the problem, because parents have been given the message to be there for their child. Sounds wonderful, but it should be there to manage your child, not be there to run around your child. So a child has to understand their responsibility. So this learned helplessness, and funny enough, you don't see that I haven't seen it yet in an assessment report. So learned helplessness comes about through parenting. As an example, there are a few characteristics. A learned helpless child likes to only do what they like to do. The moment the going gets a bit tough, Mom, come help me. Dad, I can't. They opt out of challenges. They avoid challenges unless they know they can win, so they don't want to run a race. They don't want to swim a race because it might be too hard. And then they have a fear of failure as they grow up, and they believe they're stupid, they believe they can't, and they're giving up before they even tried. So what is happening? There's a huge increase in kids in a remedial class. Now, I'm sure you know, only in our day, I mean, who is in remedial classes? But there are just so many kids. And they sit there and all they're doing is wanting help. Instead of focusing, but this child can do a lot for themselves, we end up doing it for them. So without being aware of it, we're encouraging this helplessness. And it creates social problems as well,
Of
because they end
course.
up lacking social skills, staying at home because everything's so dangerous. They're not left alone at parties, for instance, where they can interact with their friends. Mom's got to be there with them. And we're never allowing a child to be exposed to the bigger world without somebody being there. And there's so much a child can do for themselves. And I say to parents, like if your child needs stationery, a 6-year-old, you take it to the stationery shop, you stand at the door, they've got a little list, they can go alone and ask the assistant, excuse me, could you help me find this? Mom can stay at the door. They can walk around the shop with the assistant, putting things in their little basket, then come back to the till, and then mom will pay. So we're not encouraging children to do these things. We're actually trying to protect them. And remember, what is life about? Life is about survival, having the skills to take on everything that gets thrown at us. It's not easy. Life is hard. We're not teaching kids that life is hard. We
Okay.
encourage them. Yeah.
Oh, okay. We're going for an ad break. When we come back, I want to understand the thinking behind the Smart Choice Parenting Program. How successful is it? And okay, I've just been told by my technical producer that I can continue talking with you, so that's wonderful. Um,
Okay.
how and when did you decide that you need to formulate a program that's going to almost one size fits all? So,
Yeah.
whatever my needs are will be totally different to your children's needs, but whatever you have designed will address both of our needs.
Yes. Because at the end of the day, all we want is a child with good self-esteem to feel good about themselves, irrespective of their culture, whatever. So what actually happened, I'd always wondered about this. And then by chance, I had to do an extra degree, an honors degree at Pretoria University. And they were amazing. What had happened, they pulled away from the psychology department because so children aren't only about psychology. They're not only about cognitive problems, etc. And they had developed this phenomenon, they called it a phenomenological approach in terms of guiding a child to adulthood. Now, the beauty of this, it clashes with no belief system, no cultural system. It fits in. We haven't got the time to go into it. And that fitted in with my thinking. I couldn't believe it. And what happened then, I married a young woman with twins. They were very young. The one was a great tantrumer. And I developed a program around those principles, which were fantastic. And it's just been quite amazing what you can do with regular kids. We had no sibling rivalry, no shouting, no backchat. We had structure. The kids, what they had to do, they did for themselves. We don't have time to go into that. But at the end of the day, they're now young adults. And to see these kids feel so good about themselves, self-motivated, one doing medicine, and she had to get into medicine by doing an honors first in the health sciences, the other one being veterinary, but really content with who they are, coping with life because we gave them the skills to cope with life. And
So,
once we can understand that, yeah,
is obviously this is all underpinned by the core principles behind the Smart Choice Parenting program. So
yeah.
what is it all about?
All
And
right.
also, let's look at the psychological and developmental research that has underpinned this program or this approach.
Okay. So basically, as I said to you, it's guiding them into adulthood. In other words, we their guide. And they brought into life, they think you know how to do your job. So at the end of the day, the moment they're screaming and shouting, kids don't understand what your problem is. So we've got to, from a young age, that we've got to get them to trust us, that we know how to stay calm. How do we make it their problem? Obviously, there's just not enough time. So if we can understand their development. Now remember, every kid is born with a brain, totally dependent on an adult to help a child use that brain. And as an example, and this is what neuroscience has shown, that from the moment we start interacting with kids, their neurotransmitters start uh, sending off electrical currents that find pathways through the brain, and that develops the brain. What they've also found, and that's during the first 5 years, 90% of the brain is developed. Now, what they have found, and they use a term often called maltreatment. Any sort of maltreatment, where we shouted at the kid, we might have smacked them, there could be a lot of screaming, impacts on the neural pathways that the brain takes. And you'll find that they end up with, you can look at a lot of the ADHD kids and kids with anxiety. Something has happened during the transmission of those electrodes that take on the brain. And now they've got something called neurodiversity. And what we're trying to do is, because these kids think of it differently, we're thinking that if we can think like the child thinks, they might be able to learn. What they're not understanding is that learning is a choice. No matter what the kids got, if they're choosing not to learn, why? And their answers are there as well. So we can see that that is our job. And when things start going wrong, we've got to really ask ourselves, maybe we're doing too much for our child, maybe we're too anxious. And you must remember, a lot of mothers, especially if they've got a child, and I should say fathers as well, that has just been labeled with whatever, are anxious. So the mothers are usually very anxious with kids that are labeled with an ADHD or behavior problem, or they're not doing well at school, and the kids pick up that anxiety. So what I've found, the key to parenting, knowing how to stay calm. And if you take a little infant, maybe a couple of months old, and they're crying, they're screaming, what do? We rock them, we soothe them, we might sing them a little lullaby to calm them down. Now, what I've found with my program, and I've had really great success, is that I help parents take charge. Because remember, kids need to have an authority figure in their life, not authoritarian. It should be the adult that they can trust, because we're teachers. Like a good teacher is the authority in a class. The class respect him for good reason. So what I've found is that once I give parents the tools, once they know how to stay in charge, without having to scream or shout, once they can understand how to communicate with the child, I've had success right across the board. And the most common feedback I get is that the house calms down. Now, if the house calms
Okay,
down, yes.
Ken, let me come in here then. You talk about this amazing program, the SCPP approach. How does a parent subscribe to this program? Do they get in touch with you? Do they then buy the literature from you? Do you before they leave, do you kind of give them some sort of a guideline as to how to implement these principles in their lives and the child's life? Or is it a classroom environment where you have a whole lot of parents come in and you take them through the session?
And look, before COVID, I used to have a group of people. Now, most people prefer as a couple to come along. It doesn't really matter. But I give them the insight as to what is sort of going wrong. And I never blame the parents. Parenting is pretty much like baking a cake where you've only got the ingredients, no recipe. So when the cake doesn't turn out like it should be, we don't send the cake off to a scientist before looking at the baker. Now, all we've got to understand is what are we doing wrong that's creating this problem. And unfortunately, the main thing we're doing wrong today is we're doing far too much for the child. We're told to be there for them, to play with them. Kids can play on their own. That's when they're at their most creative. So instead of managing, parents are becoming their friend or even their therapist. The message we're getting is be there, sit with your child and try and get him to calm down by trying to reason with him. It's not what we're supposed to do. So when they come on the workshop, I give them all the insight. Then I implement a very practical program which they can manage, because parenting is a management job, and you got to know what you're doing. And mom and dad have to be on the same page. What I found today as well, dads are not always working together with mom, and dads need to play a really important role. So that mom, when she's a bit tired, you know what to do. So they're given the tools to work from the same page, to be consistent, to know how to help the kids become more independent, handle whatever the issues are. All the structures you need, all the boundaries, rules you've got to preempt with the children, where you get their buy-in, and we've got to know how to talk to them. If I can give you a good example, I remember once we had a rule. If I'd recorded a movie that I wanted to watch later, the rule for the kids was anybody deleted that movie without asking meant they were saying to me they don't want to watch TV for a week. One day, movie was deleted. So it was Eric, and I said, X, I don't believe you don't want to watch TV for a week. She said, why? I said, well, you deleted my movie. She accepted it, except 2 days later, she came to me and she said, Ken, when can I start watching TV again? I said to her, sweetheart, I wanted you to watch during all the agreed times. But when you deleted my movie, you actually said to me, you don't want to watch it for a week. So it's a week. She accepted it. There was not another word. And that is the key. You negotiate a rule with a child, get their buy-in, so that when they choose to break the rule, they're saying to you, I want the consequences. Like shoes lying around the house. All you got to say, sweetheart, I don't believe you don't want these shoes. Oh, I do. Well, what are they doing it? If they're not put back, they disappear. But the child has said to you, I don't want them. But you'll do them a favor. You won't give them to the poor children yet. So they've got to earn. And I've got a whole structure that I do to get their shoes back. So there's never a need to shout. Because remember, the moment we react, and that's what most parents do, we're in trouble. And it's not fair. And we're angry, and we're supposed to be the people that have to stay calm and in charge. So once you can so help parents set out structures, set out the rules, clearly spelled out consequences, with the kids agreeing they're happy with that rule, like no TV during the day is one rule. If they're not happy, I give them a chance to talk about it, but I tell them why there needs to be that rule. And it's amazing how they cooperate. Why? Because there's never shouting, and there's never speaking down to them with a big finger. You're actually speaking to them one-on-one, but with a bit of authority in your voice. And most parents don't speak properly to their kids. Now, listen, how many times do I have to tell you? Just get to bed now, you know? So we do
Okay.
that.
All right. We have to wrap up now. What I'm getting a sense, Ken, that this is a manual or a toolkit not only for us as parents to interact with our children in a very respectful manner, but I think it's teaching parents a lot of lessons as well. That's question number one. Question number two, can I buy this manual without having to come for a one on one session with you? Is it available perhaps online? Or how does this get sold? What is, in your mind, the best method in talking to parents, interacting with them, selling them the manual or the toolkit, and then knowing that they're good to go?
So I have got a book. It's called Parenting Decoded. It's available on my website, smartchoiceparenting.co.za. Plus, there's lots of articles on my website, other interviews I've done. And then I've had pretty good feedback, but a book is never quite the same as being there, being up front live. And then I explain to parents, once they read the book and they really would like, a lot of what I give, the tips in the book work. Simple little things like a kid not wanting to sleep in your bed. I mean, I can get a kid out of a bed in one day. So there are lots of little tips like that, irritating things that happen. So the parents normally enjoy it. The program is also in the book, which they could try and implement. But it's not as easy as it sounds. But they're welcome to phone me. And I help on the phone. Like after a workshop, I'm available on the phone. While they're busy implementing the program and they're stuck with a particular issue, takes a 2 or 3 minute phone call, and that's it. And often, interesting enough, because I see the family, I'm not there for the parents. So I give my card to the kids. And I say, listen, if mom and dad shout at you, you phone me, and then I'll talk to mommy and daddy. I can't see quite a lot of kids phone me, And then I talk to the parents. Just the fact that they've got some little help. It's amazing how that works. We really don't seem to understand how to connect with our kids properly, especially in this day and age. And it's too easy to just keep them quiet by pushing them to the side. So I cover virtually every conceivable problem, like school refusal. I've had success across the board. These neurodiverse kids, I've had a lot of success. Not wanting to eat their food, not wanting to get up in the morning, not wanting to brush their teeth. All of these little things, which can drive parents mad, and it's quite simple to get rid of the problem. And I could give you a few examples if you want, if there's time.
We are out of time. Let's pick up when I meet with you again, possibly next week, if you are available, because I'd like to touch on a few other issues that you've covered this morning. And then we can go on to AI tools in education and research. I think that's a real hot potato topic that we have to cover. So, Ken, we're going to have to leave it there. Thank you indeed for your insights. And next week, you can also tell us how we sign up for the program, costs involved, and where do we attend the workshops. So all of that we will cover in next week's show. Thank you once again, and God bless. Nice seeing you again.
You too, Judy, and all the best. And you're looking well. That's good.
Thank
But
you
thanks again
indeed.
for inviting me. It's been a pleasure.
My pleasure.
Thank you.
12:04 exactly. This is the mid-morning show. Let's go for that promised ad break, and then we'll be joined by our next guest.